energized by seeing all of you here today and by seeing my fellow colleagues on this panel this morning. I think it's a symbol of this integration that we're having this town hall today, that we've got so many people connected across the county together here, and if we could just give a huge applause for all the people that made this happen. Because I want to say a few words about public health, and I really love Robin's comments about the generosity of spirit. Which is really, I think, a theme that's running through how we're trying to pull this agency together. A little bit about public health. We focus in three areas: on disease prevention and control, as Mitch was talking about earlier, on health protection and health promotion. And in our public health centers, we're starting to look at how we can use those sites as well for co-location of primary care services. Those are our sites where we're providing immunizations and treatment and testing for tuberculosis and sexually transmitted diseases, but we can do so much more in those clinics, and so it's a huge opportunity for our agency. Mitch talked about how we inform the public about Zika, and we're working together on the e-consult, a great example of how we can work together. We collaborate with the 99 hospitals throughout LA County on disease reporting, and we have teams of epidemiologists that are looking at that data to see if we've got an outbreak, and then what we can do to protect overall community health. And you've seen our restaurant grades. That's a symbol of the amazing work our environmental health inspectors are doing every day out there to protect people's health. Our environmental health inspection gets over 1,000 complaints every year, and our inspectors go out and they check complaints from restaurants, complaints on housing, on pools, on weird smells, on weird loud noises and things. So they're doing amazing work out there protecting the community. And we've been heavily involved lately in community health and in environmental justice issues. You've heard about, and probably read about Aliso Canyon and our work out there around the gas spill. We're also working and out in the field in East LA and the areas around the Vernon Exide battery plant that was spewing toxic fumes into those communities and contaminating the soils in those communities. And we're out there testing the soil, providing information to residents, and we were able to amplify that work and do it much more effectively because we could do it in partnership with DHS employees and with DMH employees. And it's a way in which we can make all of our work more effective on behalf of communities and on behalf of residents. We're excited about the work that we do in public health to promote health in a number of different ways and building healthy communities. And that work we've been working on with other departments, and how exciting to be able to work more fully on that with DHS and DMH as our partners in that. We're excited about the 8 strategic priorities that the agency has put together, and we're leading 2 of those priorities. And we're very excited about that work. We can talk about that more in the Q&A because they're giving me frantic signs that I have to stop talking. One thing, though, I think is really important that I'd like to mention before I end my comments, and that's an incredible opportunity for all of us up here. And we recently funded the county's participation in something called the Advancing Racial Equity Learning Cohort. This is sponsored by the Government Alliance on Race and Equity. And this is a team of folks from across the county, and I really want to thank Dr. Katz for allowing public health to represent the agency in this learning journey that we're going on with the CEO, with human resources at the county level, with the sheriff, with probation, with children and family services, with community and senior services, and the Human Relations Commission. And we're looking at how to bolster an initiative that President Obama started called My Brother's Keeper, how to change the trajectory and improve the lives of young men and boys of color. So we look forward to sharing the learning that we have from this cohort, working with other departments, bringing it back to the agency, and looking about how we can make a difference around racial equity in the work we do in health throughout LA County. Thank you.